Welcome to the Wellness Bridge. I'm Gary Chen, physiotherapist and founder of GC Integrative Physiotherapy and Wellness on the Gold Coast. This is where Western science meets Eastern wisdom for whole person healing. Before I touch a painful neck, shoulder, or back, I am already listening to the nervous system, not with a machine and not with anything mystical, but through breath, guarding tone and readiness. Many people arrive in the clinic already bracing before I have even said what we will do. The shoulders are high, the jaw is tight, and their breath is short, fast, and protective. In that state, more pressure is not always the smartest first move. Sometimes the first intervention is not a stretch, a release, or a strengthening cue. Sometimes it is 90 seconds of helping the body feel safe enough to receive care. Today I want to explain why that small pause matters, without exaggerating what breathing can do. The reframe is simple. You do not always need a perfect calm room to shift state. A few slow breaths can open a physiological window where the body becomes less defended. If you have ever felt your pain rise before someone even touched you, this episode is for you. Because the work sometimes begins before the hands arrive. Picture walking into a clinic after weeks of waking with a locked neck. You have already tried heat, stretching, different pillows, and maybe a few late-night internet searches. By the time you lie face down on the table, your body is not neutral. It is remembering every sharp turn, every failed stretch, and every moment you felt stuck. Your breathing may become shallow, not because you are weak, but because your system is anticipating threat. This is where many people misunderstand their own body. They think, if I am tense, I must need someone to force the tight part to let go. But a guarded body is not simply being stubborn. It is collecting information and deciding whether the next sensation is safe and certain or dangerous. When someone expects pain, the body often starts preparing before the painful input even arrives. That preparation can look like breath holding, shoulder elevation, muscle gripping, or a sudden jump in sensitivity. As a physiotherapist, I cannot ignore that state and pretend the tissue is separate from the person. The muscle, fascia, joints, breath, attention, and expectation are all part of the same clinical picture. That does not mean pain is imagined. It means pain is influenced by the state of the whole human being. If the body is already on high alert, even helpful input can feel too much. So before I increase load, add pressure, or use dry needling as a physiotherapy technique, I check readiness. The question is not only where is the tightness. The better question is, what state is this person in right now? That is where the 90-second pause earns its place. In Eastern movement traditions, breath is rarely treated as a side detail. Breath is one of the bridges between attention, posture, rhythm, and internal awareness. When we speak about qi in a patient-friendly way, I translate that into autonomic and interoceptive language. In other words, we are noticing how the body senses itself from the inside. We are not claiming energy cures disease, and we are not stepping outside physiotherapy scope. We are using ancient observational language and translating it into modern nervous system literacy. Balance is not just standing on one leg without wobbling. Balance is also the ability to move between effort and ease, alertness and settling, protection and trust. Many people live in a body that has forgotten how to calm down from bracing. They are not dramatic, fragile, or broken. They are often exhausted from holding themselves together all day. In Qigong-informed practice, the first lesson is often not to perform more. It is to sense more clearly. That is why PhysioQ as physiotherapists design Qigong-informed therapeutic movement for balance, breath, body awareness, and movement confidence. It is not energy healing, and it is not a promise of instant change. It is a structured way to reconnect breath, attention, and movement in a grounded clinical frame. When a patient says a line feels blocked, I may translate that as a neurofacial pathway of sensitivity and tension. When someone notices a deep ache or spreading sensation, I treat that as a patient-perceived sensory marker. The language can be different, but the clinical discipline must stay clear. Eastern wisdom reminds us that the body responds to rhythm, attention, and presence. Western science helps us explain why that response deserves careful respect. The bridge is not choosing one world over the other. The bridge is knowing how to translate wisely. Now let us bring the science into the room. Slow-paced breathing has been studied as a way to influence cardiac vagal activity. In one 2021 experimental study, slow breathing immediately increased a vagal index of heart rate variability. Interestingly, 5, 10, 15, and 20 minutes did not show a significant immediate difference in RMSSD. That matters because it tells us the minimum useful dose may be smaller than people assume. For immediate state change, more time is not always automatically better. Another key idea is breathing around 6 cycles per minute. That is roughly 5 seconds in and 5 seconds out. A 2024 meta-analysis linked that rhythm with resonance in the cardiovascular system and improved baroreflex control. The baroreflex is one way the body monitors and adjusts blood pressure. The evidence reported an immediate reduction in systolic blood pressure on average. I will frame that carefully as support for cardiovascular control, not as a standalone blood pressure solution. The brain also seems to respond to breath rhythm during uncertainty. A 2025 EEG study found 6 breaths per minute breathing increased alpha and theta power while decreasing beta power. That pattern suggests lower cortical arousal and less mental effort when facing uncertain threat. The same study reported reduced self-rated valence and arousal compared with fast breathing. In plain language, slower breathing can help the brain prepare for stress with less alarm. Pain is part of the picture too. A 2024 quasi-experimental study in adults with chronic pain found controlled diaphragmatic breathing reduced immediate pain perception. On average, pain scores dropped meaningfully after the breathing task compared with before it. The proposed explanation was attentional, not magical. The brain shifts resources from monitoring pain toward following the breathing task and its cues. But breathing is not the whole story. A 2024 systematic review found progressive muscle relaxation had a large effect on reducing state anxiety. That reminds us that body-up signals, like releasing muscular effort, can be very powerful. So the best clinical message is not breath fixes everything. The better message is breath, attention, and body awareness can help regulate physiological state before care begins. Let me use a fictional composite to show how this looks in practice. Imagine Sarah, a 55-year-old carer, arriving with a neck that feels locked. She is tired, responsible for everyone else, and worried that turning her head will spark pain. When she lies face down, her upper shoulders are visibly active and almost vibrating. Her breathing is short, sharp, and much faster than I would like before hands-on work. In that moment, I do not see a stubborn neck. I see a protective system asking for clarity. Before I consider the manual technique or dry needling as a physiotherapy technique, I slow the room down. I place a guiding hand near the low back and ask her to breathe into that area slowly. Not perfectly, not forcefully, just a gentle 5-second expansion and a controlled exhale. After a few breaths, the shoulders begin to drop without me pushing them down. The colors of the skin softens and the body looks less prepared for stretch. That is the moment I pay attention to. I am not claiming the breast fixed her neck. I am saying her body moved into a better state for the next step. This is the wellness bridge in action. Eastern wisdom says, create safety, rhythm, and presence before asking the body to change. Western science says slow breaths can influence vagal activity, barrel reflex control, arousal, and attention. In the clinic, those two languages meet in one practical decision. I do less first, so the body can tell me more. That is often more respectful than rushing into technique. It also gives the patient an active role from the very first minute. They are not lying there waiting to be fixed. They are learning how their body responds to breath, contact, attention, and trust. Here is the practice I want you to remember. Use one 90-second pre-procedure pause before something your body is bracing against. It might be before a physio appointment, a difficult movement, a work meeting, or a stressful conversation. Sit or stand comfortably and let your shoulders be supported rather than forced down. Inhale through the nose for about 5 seconds. Then exhale slowly through pursed lips for about 5 seconds. Think of the exhale as controlled airflow, not a dramatic sigh. Repeat that rhythm for 9 breaths. During the practice, choose one body anchor. Notice the belly expanding, the ribs moving, or the chest settling. Do not chase a special feeling. Your job is simply to notice whether the body becomes a little less guarded. If 5 seconds feels uncomfortable, shorten the breath and keep it easy. Regulation should not feel like another performance test. The point is not to prove you are calm. The point is to give your system a clearer signal before the next demand. After 90 seconds, ask one question. Do I feel slightly more available for the next step? If the answer is no, that is still useful information. It may mean you need more time, more support, or a different approach. If you feel dizzy, distressed, or medically unwell, stop and seek appropriate guidance. Used wisely, this is a small clinical literacy tool. It helps you notice your state before pain, pressure, or fear takes the whole stage. That is a skill worth practicing. Let me be very clear about the boundary. This episode is education, not a diagnosis, and not personal medical advice. Slow breathing is not a primary therapy for anxiety disorders, hypertension, or chronic pain conditions. It can be a useful adjunct for regulating physiological state and supporting recovery conversations. It should not replace medical care, mental health support, medication advice, or urgent assessment when those are needed. If you have blood pressure concerns, breathing changes, chest symptoms, fainting, or severe distress, speak with a qualified clinician. In physiotherapy, I use breath as part of a broader assessment of movement, sensitivity, strength, balance, and function. I also stay aware of scope because integrative care must still be clinically responsible. The goal is not to make big promises from a small technique. The goal is to understand why a small pause can change the quality of the next moment. If your body braces before care begins, you are not failing. Your system may simply be asking for a safer entry point. Sometimes 90 seconds is enough to begin that conversation with your own body. Thank you for joining me on the Wellness Bridge. Science is the language. Integration is the method. Freedom is the outcome.